A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors. People are living longer, working longer, and feeling younger. And research shows that how you feel affects your physical and mental health. People want to match how they look with how they feel. And that's from Dr. Sam Shatkin Jr. of the Aesthetic Associates Center, pointing to a recent study published in the British Medical Journal that found that how old you look corresponds with your health, and that looking younger might help you actually live longer. Now, Dr. Shatkin says that people should not feel ashamed about wanting to turn the clock back on aging. And he joins us on this special edition of your Hometown Health Connection. I'm John DeSciullo. Welcome to our program. Let me introduce our guest, Dr. Sam Shatkin Jr. of the Aesthetic Associates Center and Medical Spa. Dr. Shatkin is a board-certified plastic surgeon who specializes in aesthetic treatments of the face, breast, and body, helping patients achieve their cosmetic and aesthetic goals through surgical, non-surgical, and skincare services that help them feel their best. He is the only plastic surgery recipient of the 5-star Diamond Award in the world from the American Association of Hospitality Sciences. And he and his team are the only medical practice recipients of the Buffalo Niagara Business Ethics Award. His state-of-the-art, fully accredited ambulatory surgery center is located at 2500 Kensington Avenue, and that's in Amherst. Dr. Shatkin is particularly excited about his new 4D, four-dimensional facelift that he developed, which he calls a multi-dimensional transformation that takes facial rejuvenation to a whole new level by addressing the 4 dimensions of aging that combine advanced techniques to target the skin, muscles, fascia, and overall facial structure for a harmonious and youthful experience and appearance. Dr. Sam, welcome to your Hometown Health Connection.
It's so great to be here with you, John.
Yeah, so let's start with that, because I understand this 4D facelift, what's so exciting about it is the entire procedure really has sort of 3 components that incorporate the techniques and newest technologies that you've been using really for several decades. And it's a kind of a 2-layer lift. Explain that procedure and what does that 2-layer lift mean?
Right. Well, I'm glad you asked that question because it's really evolved over 3 decades that I've been in practice, since 1989. And essentially, when we first started in practice, our facelifts were essentially just tightening the skin. We had some techniques that other doctors have developed over time, but it was essentially, lifting up the skin, pulling it back, and tightening things up. So one of the things now that we're seeing is that once I did that tightening, I realized that there's other things we can do with the tissues below the surface. And I wouldn't say that I'm the one that developed it, but certainly the technique that I use has been, my own development over time. But now what I'm doing is the next step that I did was take that internal layer, the muscle fascia layer, and use that to support and anchor the lifting of the skin. So we're not relying all the tension on the skin alone. We're giving it more support. So then, moving forward in my career, I started to realize that instead of discarding that internal tissue that we're normally lifting up and discarding, now I'm going to take that tissue and use it for the 3-dimension, which is building up volume. So now we're tightening the skin, giving it support, and volumizing. And that's what the 3D facelift was.
So kind of filling out someone's features, if you will.
Well, what happens is as we age, you lose volume in your face. It descends from the fullness of the cheeks down into the jowl area. Nobody likes it down there. So my goal was to bring that back up and to lift it up into the cheek area. So that's what I do with that internal fascial tissue. We just reposition it essentially into a higher position.
So that basically defines what we would make the 3D.
Correct, yeah. That gives it that youthful look with lifting and volumizing.
You really kind of worked with others, but this is really something you've perfected.
Yeah,
at the Aesthetic Associates
I will say that we rely on other colleagues around the country, around the world, to help us know better about the anatomies and things like that. We're constantly students, when we are doing surgery, and that's why they say, doctors are in practice, because we're always, trying to better our results and our treatments. So I've taken that to the next step, I think, in my practice, and evolved into this newer, 4-dimensional facelift, which I really think is special.
Well, let's go back to the 4D. So I understand you target these skin imperfections. So, we all have, as we age, so these imperfections are lines, and age spots and things. But what makes this part of the procedure different from what you've done before in that final step?
Right, well, that's a great question. So over the years, we've been doing skin treatments. Sometimes we'll do it before surgery, sometimes we'll do it after surgery to try to get that skin looking its best and improve the quality of the skin before we do the facelift. But what we're doing now is we're incorporating it in the operation during the surgery. So it's a four-dimensional facelift all together. And the advantage of that is now we're stimulating the skin to improve the quality of the skin, improve the texture of the skin, improve coloration of the skin. Some people have some dark brown spots and things like that. And by doing it all together, I think 1 + 1 is not 2 anymore. 1 + 1 is 3. We're getting more out of it because we're lifting the skin, as I mentioned. We're doing that internal support. We're doing that internal volumizing. And now with the 4-dimension, we're actually resurfacing the skin to improve the quality of the skin and the elasticity. So by putting it all together, again, I think we're really getting a bigger benefit than if we try to separate all those components.
It sounds complex, but yet at the same time, it seems like it's very efficient with all of the technology and the way you're working the face and the skin.
Right. Well, I don't want to make it sound too simple because people won't realize, because it's complex in the operating room, but it's simple to understand what we're trying to accomplish. Essentially, rejuvenating the patient. And I think the best part of our rejuvenation that we do at the office is that we're making the patients look more refreshed, more natural, more youthful, of course, but it's not making them look like they had a facelift. It's not making them look so pulled and tightened because now we're using the deeper anchoring and the revolumizing, so we're really incorporating a lot of things to just make it look natural.
That's an interesting point. Some people have had work done and you hear whispers like, "Oh, they must have had work done." Yeah.
Well, in my practice, I don't want anybody to say, "Who did your facelift? Who did your rhinoplasty? Who did your breast surgery?" I want people to say, "Gee, Sue, you look natural. You look more youthful, more rested. What are you doing?" Yeah. And a lot of times they don't tell them what they're doing because not everybody admits to it.
Let's talk about some technologies. I understand you use laser skin surfacing, micro-needling, and other technologies to target pigmentation irregularities, sunspots, fine lines, and wrinkles. Tell us what those technologies are all about.
Right. Well, the most important thing is that we're addressing the patient's concerns. If they've got brown spots, we're going to try to approach that to treat the brown spots. And when we're talking the 4-dimensional facelift in surgery, we have different options to help with things. If we're working on texture, I might use a laser. If we're trying to improve the quality of the skin and rejuvenate it and tighten up the collagen and the elastin fibers, then I'll probably use a radiofrequency microneedling device like our Morpheus that we have. So it really depends on what their problem is, but everything we do in the office is customized for the individual.
And we should make mention, this happens at 2500 Kensington. This is in your facility.
Well, I'm really proud of the facility we have. We've been fully accredited since 1989. I'll give our father credit to that because he, as a dentist and a plastic surgeon, set up this unique facility, which is really different than anything in the country as far as I'm concerned. So we got the full accreditation, just like any other hospital or other ambulatory center would have to have, and we've had that continuously since 1989 for 34 years.
Yeah, and just as an aside, your father and your brother, started the Aesthetic Associates Center. Tell us a little bit about your dad, because you were very close.
Yeah, so, our father was very special. Just to give a quick synopsis of his background, his career. Unfortunately, he's no longer with us, as you know, John, but he and I were partners along with my brother for over 20 years. But he started out as a dentist, went to University of Buffalo Dental School, and then wanted to train in oral surgery. So he went to New York City, Mount Sinai Hospital, and became an oral surgery trained dentist. Came back to Buffalo and was practicing oral surgery and dentistry. And while he was in New York, he discovered that he was treating a lot of these offspring from the Hiroshima victims where the offspring had cleft lip and palate.
Wow. Got
very excited with that, and the best way to treat that is with plastic surgery. So when my dad and I started in practice together, when I joined him in 1989, he and I were doing a tremendous amount of facial reconstruction with cleft lip and palate for the children, the infants, and that was really special. I really loved that. So my dad and I had a chance to really, connect and get our practices glued together. Over time, though, my practice evolved more into aesthetics. So my dad was doing both the reconstructive and the aesthetic, and now in my practice, I'm pretty much doing the aesthetics. But what's interesting is the techniques that we use, the things that we learned about tissues and management of how to manage the skin, was developed from these reconstructive procedures over many, many decades. So I still every time I do a procedure, I'm thinking about our father and
sure.
what he's done to help us get to where we are.
You're doing God's work. And your brother is Todd Shatkin, prominent dentist.
Of course.
So let's talk about the surgeries that we just identified. What's the recuperation for a person that goes through it in that 4D facelift?
So what's really interesting is I've had patients in my office and say, you mean I can take a shower the day after the surgery because other friends of them might have gone somewhere else? I have a routine that I've been following since 1989, and it works really well for my patients. The surgery for a facelift, the 3D or the 4D facelift, is around 3.5 to 4 hours. You know, it varies depending on, sometimes we're doing the eye lift along with it, or something special with the neck. But once we finish that, we wrap them up in some bandages, so it's like a turban, goes around their head and underneath their chin, and then they go home and relax and come back to see me the next day. The next day, I take the bandage off. And then I always tell them, you know, this is going to be a bad hair day because their hair's been matted down. But they go home and take a shower, wash their hair, feel a little bit more normal, even on that first day. Now, of course, there's some swelling. So if you look at the full recovery, generally I tell the patients that around 5 to 7 days, they'll probably feel comfortable getting out and about, maybe, you know, going to get some groceries, running an errand, or even going out to dinner with their friends or family. But as far as full exercise activity, that'll be more like 3 or 4 weeks.
Interesting. We have about 3 minutes left in our first segment.
Sure.
Let's talk about the age of the individual that would sort of go through this surgery. I mean, I'm 61. You know, I have to admit, I've thought about, you know, how are you going to look 51? You know, who would be a candidate for plastic surgery? Is it age driven? Is it just the need for them to look their best? What is that?
Well, first of all, I'll say 61, your skin looks really good.
Oh, thanks.
So you're taking care of it. And I do tell patients, and even when they're young, to make sure that they're protecting their skin, you know, from the sun. I think the sunscreen is the best thing. But our age for surgeries could vary anywhere. I've done facelifts on individuals in their 30s if they have early aging, or even up until the age of 75 and 80. It really depends. But I always encourage patients that if they have a lot of laxity of the skin and if they're not happy with what they see, they need to be, you know, talking to us sooner, because it's a very dramatic change when I take an 80-year-old and do a facelift on them. But if I take somebody in their 40s or 50s and just do a little tightening or rejuvenation or maybe even non-surgical treatments, all of a sudden they're starting to look better and turning the clock back gradually instead of a dramatic change when they reach 70 or 80.
Do you see a lot of men coming in?
No, we do see some men now. You know, early on in my practice, it was about 95% female. Now it's maybe 85% female, and men is increasing. A lot of the men come in mostly for just non-surgical things because men are generally a little wimpy, so they don't want to do too much surgically. But the ones that do, it's mostly we're doing eye lift procedures on them because they feel like they're looking a little older and in the workplace that might affect them. Or because they're competing with younger people. Or we're doing, a lot of men come in for body contouring, gynecomastia, which is the male chest. When they get a larger chest, we can reduce that to give them more shape. So those are the procedures we're doing mostly with the men.
Interesting. Well, we're going to continue our conversation with Dr. Sam Shatkin after this brief break on your Hometown Health Connection.
Hello, I'm Dr. Sam Shatkin Jr., board-certified plastic surgeon. In addition to my many other aesthetic treatments, I'm now offering the revolutionary 4D facelift exclusively for you. Look your best in the new year. Make the resolution right now to give us a call at the Aesthetic Associate Center. Come in for a free consultation. Just mention Buffalo Healthy Living Magazine, 716-800-6026, and find out more at drshatkin.com.
Welcome back to your Hometown Health Connection. We're talking with Dr. Sam Shatkin Jr. about turning the clock back on aging through various procedures that can help people look and feel their best, and how people who look and feel younger are even living longer. And of course, scientific research says, I guess if you look good, you feel good, you're going to enjoy life. But you know, Sam, let's pick up on the conversation. We talked a little bit about the look when someone goes through a procedure, and sometimes people would say, you had plastic surgery, who did that? But are people sometimes embarrassed to maybe just step up and say, I need to get something done, or I need to reverse that process? Do you find that there are people who hesitate? Because once people go through it, I would think they are really feeling excited about their new look.
Right. Well, you know, I think I'm very good with patients, talking to them and explaining about what we're going to do. I really try to get to the roots of it. You know, many times a plastic surgeon is as much a psychiatrist as they are, a plastic surgeon, because we want to understand what bothers them. We want to understand that they realize what their expectations are with the results. But I don't want people ever to feel like if they have something that bothers them, they should seek some attention and come to a plastic surgeon is the best way to do it, or a cosmetic dentist, if they're bothered by their teeth. Because we want to build confidence. We want to make people to feel better about the way they look. And like you pointed out, there's been several studies that have really shown that if you look better, you feel better, and you actually live a better life and you live longer. So we want everybody to, look their best and feel their best.
Well, and with your brother, Dr. Todd Shatkin, we've talked about that with some of his procedures, mini dental implant particularly. And people should not look at it as a negative in the sense that if they have a certain age and they have maybe a few more years left, okay, let's be real. Or if they're a little younger and they've got a longer term, you really, like you said, should live your best life. What are the patient's responses when they go through even the most basic of procedures? What do they say to you? Because I know what they say to Todd. They say, I can smile again and I can feel great. What do they say to you?
Well, after the procedure, I hit a woman yesterday that said, this was life-changing. I did a facelift on her, recontoured her jawline, gave her some more projection of her chin, and she said, this was life-changing for me. We did some body contouring and a different procedure for her, but she didn't say that. She said she really likes the way her clothes fit now and the way her tummy looks in the mirror. But the life-changing part of it with her face, because everybody sees the face as you're moving around, and I think that really made a difference. And that's the kind of response I get from my patients. They're just happy to feel more confident about things, and if I can help them with that, I feel that's really very positive for me as well.
Yeah, you're changing their life. Well, we talked about the 4D and the 3D and all of that in the previous segment, but what are the other procedures that you offer? And I know your website has all that information.
Right, yeah, so we do all these procedures right at the Aesthetic Associate Center. We've had, like I said earlier, we've got a great complex there. But we do, moving onto the face, we do rhinoplasties, eye lift surgery. We do, breast procedures, cosmetic breast procedures, which would be, in many cases, the mommy makeovers is sometimes the lifting of the breast because they've have some sagging after pregnancies. We'll do tummy tucks, liposuction, contouring of the legs as well. So really head to toe. And if you're a plastic surgeon, you've had general surgery training, so you feel comfortable working on the whole body. Many plastic surgeons that are only facial plastic surgeons might only be confident with the areas above the neck, but I like doing the procedures all over the body.
Yeah.
Nice variety. I know my brother loves dentistry, but I like to work in different areas of the body. I think it really is a very complimentary thing for what I try to achieve.
And we should make mention, Dr. Shatkin, you're it. You have a team there, but in terms of the individual that you're going to work with when you have a plastic surgery or a procedure, this is the guy.
Well, you can say that, but it's a team effort, because without my surgical nurse, who's been with us for 34 years, without even my team of estheticians that help prepare the skin and get it ready for any procedure we do, in addition to my office staff,
they've been there a long time.
Yeah, well, my general office staff has been there for 25 years. She's our office manager. We've had one of our estheticians started out as a medical assistant. Now she's our lead esthetician. She's been with us 27 years. And as I pointed out, my nurse has been with us 34 years. So it's a really great team. I mean, it couldn't be any better. We're a very smooth running operation, and no pun intended. But it just really works. So, people might give me credit for doing the procedure, but without my team, I wouldn't be there.
Yeah.
Wouldn't have it.
You're very humble. But let's talk about your team and how you're working with the patient to make this affordable. I mean, there's certainly a cost to this, but it should not, if you're out there watching, you should not look at this as something that's unattainable. You can make this affordable for people. How do you do that?
Well, in addition to offering reduction in fees with the fact that we have ambulatory surgery center in our office, which is always a lot less expensive than going to the hospital. In addition to that, we offer things like care credit financing for them. Currently, we offer 6 months, no interest. So it's something that makes it easier for the patients to do. They can finance it, similar to what they would do if they had to make a payment on a vehicle.
Yeah.
So we try to make it easy for them, and we do, as I mentioned, it's discounted because they're doing it, in an office setting.
Now, what Dr. Sam Shatkin is offering to anybody watching your Hometown Health Connection or reading the Buffalo Health Living magazine article about you is taking the $75 fee and waiving it, making now a free consultation for somebody that's going to call the number that we'll show on the screen and or come out for a visit. We appreciate that.
Right, yeah. Well, the free consultation, I think, is helpful for individuals just to get an understanding of what they're trying to accomplish. Because many times they're not sure what's available, not sure, you know, they can look at a website or go on Google, but if they come to the office, they talk to us face to face, I get a good understanding of what bothers them, and then I can actually help them figure out what would be the best way to manage it.
We talked about the fact that everything is happening in your ambulatory surgery center. Is that how you would define your office?
Office-based surgery center,
Office-based surgery center. Do people go home same day? They don't stay overnight there, do they?
They do. They don't have to stay overnight, and that's the nice thing. When I started in practice, when I was working with my dad, we used to do cases in the hospital. Patients would go in the night before, stay overnight, come out the day after the surgery before they went back home again. So we don't do that anymore. Now that's why they call it ambulatory. You're going home the same day. You have to have a responsible adult to help you with that first 24 hours, but it doesn't have to be a nurse. It can be just a companion, a family member, and then they come back the next day. And you know, we always see, almost all my patients I'll see the next day to make sure they're healing well, and we take the bandages off and check on everything.
Yeah, and we should mention this is a state-of-the-art facility. This is something that, you know, has grown over the years, and it's quite a campus medically.
I would think so. I mean, we've got 3 operating rooms that my brother and I share with some of the other doctors there, we recently renovated them just a few years back. We've got the very best airflow filtration in our operating rooms that is only available at our office currently. I mean, there's a couple other places in the United States that are going to be incorporating that, but it's a very unique setup that we have.
And let's talk a little bit more about some of the things you mentioned earlier about some of those other minimally invasive techniques. You know, you mentioned what, rhinoplasty and a few other things. What would you define as minimally invasive? Like you know, just like a little eye push?
Right. Well, you know, any of the procedures that we do as outpatient surgeries are, you know, less invasive because you go home the same day. But when we talk about minimally invasive procedure, we're talking about things like, you know, Botox and fillers and body contouring with non-surgical methods. One of the things that's nice about our practice is that we offer the surgical and the non-surgical. You know, many practices that are doing aesthetics are only offering like injections or skin treatments and things like that. And sometimes that's not the best treatment for them. You know, so we're able to offer them the optimum treatment, like the body contouring procedures that offer non-surgical fat reduction. They may be a candidate for a tummy tuck, and maybe they're not a candidate for that non-surgical, but if all you have is a hammer, the whole world looks like a nail, and you'll try to incorporate those procedures that you do on those individuals. So I don't know if that's ideal. So especially if you're listening to the show, come in for that free consultation before you initiate a treatment somewhere else, because we can help you figure out what would be the best treatment.
It's important you get the second opinion from you if somebody else...
Or first opinion if they want to come to us first, yeah.
So let's talk a little bit about tummy tuck and weight loss and all of that. I mean, let's be honest, people want to look trim, lean, and fit. Is a tummy tuck for everybody?
Yeah, so it sort of is the same thing you were mentioning earlier, like why do they come to us? They want to feel confident, they want to look their best. Many women that have had children understand what changes happen to their breast and to their tummy and the looseness of the skin, looseness of the abdominal muscles, and we can help them that with the mommy makeovers. But it really depends, again, on an individual, you know, customized approach. So we can help them with that.
Just talk about weight loss a little bit. Do you help in a sort of a non-surgical way to help someone
We do.
work on their weight?
Yeah, over the years we've been doing weight loss classes in our office to help patients achieve that goal. Sometimes when they lose the weight, they have loose skin that we need to help them with. We're also offering the injectables now, the semaglutide medication for those that qualify for it if they're extremely obese and they need to lose the weight. And we're also, we took a hiatus during the COVID, but now that COVID is done, we're introducing our weight loss classes again at the Aesthetic Associate Center. It's going to be a weekly course for 6 weeks program to help them get on track. And sometimes we don't need to do surgery on them. Maybe just losing the weight is all they need. Maybe they don't need liposuction, need to have better changes in their lifestyle.
Well, I was just going to follow up with that because if, as a plastic surgeon, you would think your first goal would be to work on somebody, but in this case, you're actually counseling them on how to lose the weight, so they may not even need the surgery.
Yeah. So we're busy in our practice, and I think the main thing is to get the patients to where they want to be. And if they can achieve that but with better health and weight loss, and they don't need the liposuction, for example, then I'm okay with that, because they'll come in for other things, and over time gravity will catch up with them anyway, and they'll come back to see me. But the point is that I think that these individuals, that they can benefit from the services we offer, and they don't necessarily need to jump into an operation if we can help them with other things.
You have another way to help people, and that's through your medical spa, which is located at 2500 Kensington.
Right.
And we don't want to forget, because your wife is, she's going to call me and say, you didn't know it. The Tre Ore Spa. What is that all about?
Well, you know, several years, 10 years now, she's been in business. We do complementary procedures. She does all the body and the massage therapy at their facility with their massage therapist, but they also offer skin treatments as well in a spa-like setting. Our office does the medical treatments more on the medical setting, so we sort of complement each other. But the Tre Ore Spa has been at the Mosey Hotel in Williamsville, right at the corner of South Forest and Main. It's been there for 10 years, as I mentioned, and they offer great services there too. It's really a nice place.
So you're looking at not only helping somebody with the surgical procedures at the Aesthetic Associates Center, but maybe now moving it to the next level where there's that spa treatment to really make people feel their best.
Right. Well, I mentioned before, head to toe. We offer head to toe treatments, and if you're talking about massage therapy to help relieve some tension and stress, and some medical therapeutic treatments as well, they can offer that at the Tre Ore Spa.
And the Tre Ore Spa is some place that people could go to, even if they don't come to see you, they can go in and just get a spa treatment.
Oh, absolutely. Well, they offer services, as I mentioned, similar type services when we're talking about facial treatments, but we don't offer any non-surgical body treatments that you talk about with massage therapy and the body wraps and things. That's where the Tre Ore Spa comes in.
Yeah. Dr. Sam Shatkin Jr., where are you located?
We're at 2500 Kensington Avenue in Amherst, New York. It actually is just down the street from where I grew up. So we know the community, we know the area. We love taking care of our neighbors. It's just a fun location.
Yeah. So whether it's the new year or it's the time of the year, in the middle of the year, and you want to have a makeover, you're getting into a new relationship, a new job, or you just want to feel and look your best, it's time to make that call and come to see you.
I think so. New year, new you.
Yeah, new year, new you. Dr. Sam Shatkin, thanks. We're going to have that information on where you can connect in just a little bit, so stay with us. But we want to thank Dr. Sam Shatkin for joining us on your
Pleasure
Hometown
being
Health
here.
Connection.
Pleasure being here.
Thank you. So much great information. Now, as Dr. Sam Shatkin said, you can get in touch with him at the Aesthetic Associates Center. Now, here's the website. It's drshatkin.com or drshatkin.com, and you can call them at 716-800-6026, 800-6026. Remember to mention Buffalo Healthy Living Magazine and your Hometown Health Connection, and you will get a free consultation just by calling and mentioning our show. Now, the Tre Ore Spa that Dr. Sam's wife runs, they're available online at spabuffalo.com. spabuffalo.com. And the phone number here, 716-478-7546. And of course, Dr. Shatkin is on social media on Facebook, LinkedIn, and X, which is Twitter. Thanks, everybody, for watching your Hometown Health Connection. We hope you look your best always. Thanks for watching. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.